Well, a warm welcome to today's talk. It's Monday the 3rd of May. Going to do a bit of sort of global orientation today to see what's going on. Still bad in India, but things greatly improving in the UK. So pretty mixed picture really. And we'll finish off with a scientific report, which I think is pretty good news about the medium and longer term on the longevity of immunity. But let's start off with a bit of orientation first of all. So new daily COVID-19 confirmed cases per million. English-speaking countries now, of course, Australia and New Zealand are competing for bottom place. Barbados, quite a few of these Caribbean islands are predominantly English-speaking. So good to see that the small island of Barbados is relatively under control, certainly better than the UK. Moving up with the other English-speaking countries, we see Ireland a bit higher, I'm afraid, although, has to be said, lower than quite a few European countries. So the people in Ireland made quite strong sacrifices, really, and are doing reasonably well considering the amount of vaccines they've had access to. The United States, well, it's definitely going down, but very slowly. We'll see more from the States later. And Canada at a higher level, but it is starting to go down somewhat. So a bit of a mixed picture there in the English-speaking countries, really. More orientation. These are new confirmed cases, again, per million. Now, this is the South American, Middle American situation. And if we start off with the countries worst affected, we see Argentina's there at the top. But cases do seem to be coming down now. Then Colombia, Paraguay, Brazil. Peru, the data from Brazil has been all over. The data from Peru, rather, has been all over the cases. This zigzag here. Probably not accurate, but it's just the way the data is coming out of Peru. Then Canada. So Canada just under Peru. Bolivia, Cuba, Panama, Mexico. So that's sort of the situation in South America. Still quite a lot of difficulties in countries like Brazil, of course. Moving on, last orientation shot. This is Europe. So going from April to May in Europe. So starting from the bottom, UK and Finland with the lowest numbers of cases. Then Norway, then Ireland, Denmark, Greece, Czech Republic, Hungary, Germany, Belgium, France, Netherlands. And I'm afraid Sweden has still got the most cases, although gradually going down and a bit of a flattening out. So that's just kind of a bit of a orientation in what various countries are doing. Let's start off with looking at India. Now, still very distressing reports coming from India. I hope you got the chance to listen to Dr. Nair a few days ago, who we interviewed from Mumbai, and the pre-say I did of that. Still great difficulties with oxygen supply. Still people not able to get into hospital. Certainly people not able to get into intensive care. Lots of people dying through lack of intensive care facilities. Now, ventilators are being sent from the UK and quite a few other countries, but ventilators only work if you've got the oxygen to pipe through them. Otherwise, they're pretty well useless. And of course, you need very, very high levels of expertise in the staff to operate them. So hopefully they'll be useful. I would have thought basic oxygen equipment is probably going to be of more beneficial to more people. But of course, you know, the Indian diaspora around the world are really desperate to help, as indeed are many, many people. So oxygen concentration is probably the most useful thing to send. Oxygen infrastructure is being improved in India, but it's very delayed. The lockdown in India, there's not been a national lockdown this wave at all. Some states are imposing stricter restrictions than others. National lockdown is being resisted by federal government. But of course, so many people in India depend on what they eat that day from what they earn that day. So it's just a remarkably difficult and distressing situation. And still high death rates. Now, if we look at the official figures, which we know, we've looked at this before. We know these are significant underestimates. That was actually Saturday's case number. I haven't got one for Sunday yet. So this is going to be well over 20 million now, and deaths still increasing. So, as we've said before, it's the trends. that are alarming from India, and they're still going up. Now, the cases in India will carry on going up for the next 2 weeks, according to Dr. Nair, and he's an infectious diseases consultant on the ground. So it's going to be the 15th to the 20th of May that the cases in India level off. And then only then they're going to fall down gradually, and they're going to stay relatively high all the way through to August. So we've got the rest of May, June, July and into August before the cases in India start dropping off significantly. Let's hope so much more medical infrastructure is in place really quickly, otherwise the situation is really a bit frightening, to be quite honest. So daily cases in India, so this is the 4,000 line there, that's the 300,000 line there, so that's 400,000 line, 300,000 line, and we see I'm afraid we're basically getting towards the 400,000 a day line, and the direction is up. And as we said, this will keep going up until about the 15th of May, maybe even as late as the 20th of May. That is what is going to happen. So this is going to carry on increasing. If it doesn't, I will be delighted and will correct and apologise straight away, but unfortunately I don't think I am wrong. So India's going to be difficult to watch over the next few weeks, and of course even more difficult to live in. So if you're watching in India, people around the world are really feeling with you, and I'm delighted to say that aid is coming, and Indian infrastructure is improving, but it's starting from a low base, because a lot of the provision that was put in for the first wave was actually dismantled due to complacency in various circles, unfortunately. Deaths in India, well, likewise. So this is the 3,000 a day deaths line here, and it's well over the 3,000 a day death line now, and it is completely inevitable because of this increase in cases here. A proportion of these are going to die. That's what we call baked in. So this death rate is going to carry on increasing for some time. And what happens to this line, whether it carries on going up following the cases right up until the end of May into July, or because of the month's delay, or whether it starts levelling off and hopefully going down, will depend on the infrastructure and medical provision in India. Because it seems that a higher proportion of people in India are getting sick compared to the 4, 5 or 6% that got sick in the waves in the United Kingdom and United States. Now, we know the factors in India. There's overcrowding on transport, there's been political rallies, and there's an election just going on still now, I think. There's been the mass religious festivals. All these things are going to contribute towards it. The lack of preparedness. But of course, it's also the new variants. Now, in the north, as far as we know, although the genomic testing in India is very limited, but New Delhi area, it's the B117, largely the UK variant. Maharashtra area, which is another epicentre, is the B1617, this new India so-called double mutant. Now, how much is which, we don't really know. Now, what I didn't want to find out is what effect the B1617 variant would have if it got to Western countries. Now, I was reassured that Dr. Nair did tell us that he thought Western countries were in a much better position to cope with this new contagious India variant compared to India. Let's hope he's right, because I think we're about to find out. I'd hope not to find out. Nevada, there's 7 cases reported of the India variant. Now, these are popular news reports, but it is quoting people in the in authority. 6 in Washoe County, is it? I don't know the pronunciation. Sorry. 1 in Churchill County. So these are definitely located to geographical areas. Epidemiology program manager. Washoe County residents did not appear to have travelled. Now, this is concerning because it means that there may be some community transmission in these cases. They did not appear to have travelled. And the CDC doesn't seem to be up to date. It's not listed. It's not listed as a variant of interest let alone a variant of concern. So let's hope the CDC is not dropping the ball on this India variant, because there are so many unknowns about it that we simply don't know how severe it's going to be in terms of increased transmission. We know it's more transmissible. We don't want to find out how that affects Western countries, but unfortunately it looks like we're about to. We bounced up and down about the travel on this channel, but it carried on for far, far too long. Australia being a notable exception, of course. Right, Cambodia. Now, I know Cambodia fairly well. I've done quite a bit of teaching in Cambodia. Population is about 15 million. Cambodia, a country that suffered so much, of course. I mean, it was bombed extensively in the Vietnam era in the 60s. And then the Khmer Rouge were there from 75 to 79, killing who knows how many people, probably at least 2 million in the killing fields. Then there was the Vietnamese occupation. And Cambodia has been improving lately, but it's still very, very poor. A lot of very poor people in Cambodia and a lot of corruption. So worst outbreak so far, unfortunately, in Cambodia. Worst of the pandemic to date. Now, new daily cases in Cambodia. They are starting to increase a bit. So here we have the new daily cases. Where are we? Am I here? There I am. Right. Now, the cases aren't that high at the moment, but they are increasing. So we have a definite increase, unfortunately, in Cambodia. And the thing that's concerning about the increasing cases in Cambodia is they're all linked to the UK variant. More transmissible. There's a ban on intra-district travel, mandatory mask wearing, nighttime curfew, enforced lockdowns, stringently enforced lockdowns since the 5th of April. And there's red zones where people can't go home and they're depending on the government for food, but it's not always being delivered, apparently. So very grave difficulties in the way that the lockdown is being administered in Cambodia. All markets in Phnom Penh, capital city, are closed. Food deliveries are often not delivered by the government. First vaccine, there is 1.3 million doses have been given, so the vaccination program is making a good start. And the vaccines are all Chinese related. Sinopharm with some Sinovac. There's a little bit of Oxford AstraZeneca from COVAX. So most of the suffering in Cambodia at the moment seems to be from the way that the government is not ensuring food delivery to poor people in lockdown areas. This seems to be the main problem just now. Next door in Thailand, also new variant driven. Thailand, of course, there were very small amounts back in the first part of the pandemic. They closed quite a few things down. But this time they haven't got away with this, which what for them is their second wave, and it's increasing quite dramatically now, driven by mostly the UK variant. So these new variants are having the devastating effect in many countries that they had in the UK now. Sad to see. Now let's have a look at cases in the United States. Where are we? Here we are. So as we've said, sort of a bit of a levelling off and going down a little bit. But the daily moving average there is still around about 50,000. So it's still quite high. Deaths in the United States going down still remarkably slowly. Still above the 500 a day mark. Vaccines in the States are going well. So 44.3% of the entire population has had one dose. 31.6% of the entire population now had 2 doses. So this is encouraging. Of course, in the United States now they're vaccinating everyone over the age of 16. So governments, of course, are appealing for people to go and get vaccinated now that they are eligible. So there's the links from the States. Check them out for yourself. I always put the links. UK-wise, there's some links for the UK data. Let's see where we're at. So basically everything from the UK is looking pretty good. Things are going down quite nicely. So positive people testing positive down 10% on the week. Deaths within 28 days of a positive diagnosis down 31%. Patients admitted in the last 7 days, under 1,000 patients admitted to hospital in the last 7 days. So all of those parameters going down nicely, and there's plenty of regional data and things if you want to see it. To look at the cases graphically, going down as we see, but still there, not flat. Well, flat-ish. Well, no, it's flat. Cases are still going down, but they're still there. They've not gone away. Hospitalizations, again, the rates are down significantly. That's the number of people actually in hospital at the moment. So that's looking certainly much better than it was. Vaccinations in the UK. The vaccination figures in the UK are good, first dose, second dose. I'm hoping that's going to be 618 soon when I get my second dose. I haven't got it yet. About 10 and a half weeks now, still haven't got it. So these are people who've received the first dose. Of course, that's gone down because the vaccines are now being used to give people their second dose. So the second dose figures are up. So that makes perfect sense. First dose figures down, second dose figures up. And this graphic here showing the population of the UK is those over 18. So it's good, but it's better than the United States, but not as much better as it looks, because that's the population aged over 18. And COVID symptom tracker data also looking much better. So people who are currently predicted to have symptoms, so the prevalence just over 15,000 in the UK. New daily cases 859. These figures are so refreshing. They're still there, but still refreshingly low over what we have had. I think we'll maybe take time to look at the graphic this morning. So here we see the cases going up in September, October, November. Then we had the introduction of the tiered system, which was working quite nicely, mostly with the old variant. Then the B117 hit, and that's what the new variant did to the UK. But then we had the lockdown, which started to release things, and then the vaccines also started to have an effect as well. Now, that illustrates what a powerful effect the new variant has. And that's on a country like the UK, where we were able to largely lock down, where we were able to kick up the vaccination programme really quite significantly. But these new variants, and including the B117, are having these effects in places like Cambodia, Thailand, India, where they're not as able to respond. But that increase that you had in the UK just shows how powerful the increased transmissibility of the new variants are. Right, so that was the news for today. Now, the next thing I think is good news. Now, this is to do with the longevity of the... Now, yesterday we looked at the longevity of the immune response to vaccination, which is encouraging, around about 8 months so far, and counting, because time is still going on, of course. So quite encouraging from vaccination point of view. And this paper is also quite encouraging from the natural infection point of view. So longitudinal analysis showing durable and broad immunity memory after SARS coronavirus 2 infection, with persisting antibody response and memory B and T cells, which is of course exactly what we want. Now, I know that Dr. Nair told us that he's seeing people that have had the infection and been vaccinated, but he's seeing people that are ill. This is actually, I think, a more scientific way to analyse the problem. And it's much more encouraging, I believe. So now this work was done in Seattle, Washington and Georgia. So 2 centres in the United States involved. Now they've recruited 254 patients who had COVID-19 Females and males aged 18 to 80, so good spread of individuals there. Now it's a longitudinal from early infection for 8 months, found a predominantly broad-based immune memory response. So we're up to 8 months. Now this is just how long we're up to. And it's the same with the vaccine. So the immune response from the vaccines is so far lasting for 8 months after 2 vaccines. The immune response from natural infection is so far lasting for 8 months. Now next month we might find out that that was it. It just lasted for 8 months. But that's very unlikely. It's very unlikely that the immunity will be fairly good and then just drop off all of a sudden. So, I think we can say for sure that the immune response here is lasting for about a year now. And of course, the year after that we'll know if it lasts for 2 years, and the year after that we'll know if it lasts for 3 years. We simply don't know. This is where we are at now. But I am optimistic, and I have been for some time, that we can eradicate this virus. And this is evidence towards that. Spike binding and neutralizing antibodies exhibited a biphasic decay. That was interesting. So what they found was, if you looked at the amount of antibodies, that it went up first. They went up first of all and stayed up for a while, but then they went down for a bit. But then after a bit, they started going up again. So and only went off, sort of fell off slowly. Now, strange why that should be. I don't pretend to understand that, but that's what they found, this biphasic response. So people thought, ooh, the antibodies are dropping off after just 3 months, 2-3 months, but actually then they started picking up again. So really very, very encouraging. And this was spike binding, neutralizing antibodies, spike binding and neutralizing antibodies. So the spike binding antibodies are one type of antibody. Now, what the spike binding antibodies do is, if these are the infectious spikes, of course, that we know of, and we know the receptor binding domain that actually fits into the human cells is on the end of that. Now, what the spike binding antibodies do is they bind onto that with these Y-shaped molecules bind onto that, and they block that off, and that stops that fitting into a cell. It can no longer fit into the cell because the antibodies get in the way. So it's like you're trying to put your key into your lock and you put your hand in your way. It blocks it. So that's good. They were exhibited. And also neutralizing, so spike binding and neutralizing antibodies. It doesn't actually say this, but it was in the paper, that there's also agglutinating antibodies as well. So like if you've got lots of viral particles there like that, lots of little viral particles, then some other antibodies will come and sort of basically clump these together. So the antibodies these Y-shaped molecules will join them together like that. So you'll end up with lots of antibodies agglutinating all the viruses, and when they're all in one place, they can be easily gulped up by the phagocytes, the eating cells. So quite a few types of antibodies exhibited, and this interesting biphasic response. So that was interesting. Now, half-life, the saying is greater than 200 days. Now, the half-life is the time it takes for the antibody levels to halve from what they were originally. So that means in another 200 days, if it does turn out to be a minimum of 200 days, in 400 days there'll still be 25% of antibodies left, which is good. But of course, we know that it's the cells that make the antibodies that are probably more important. Anyway, suggesting the generation of long-lived plasma cells. Now, the plasma cells are actually the B cells, the B lymphocytes. That actually produce the antibodies. They produce the immunoglobulins. globulins, which are, of course, the antibodies. So these plasma cells. So what happens is the B lymphocytes actually differentiate into plasma cells, and the plasma cells produce the antibodies. And they're seeing longer-lived plasma cells. So these cells that make the antibodies live for longer. Unusual, actually, because normally what happens is the plasma cells. Normally what happens is the B cells differentiate into the plasma cells. The plasma cells produce lots of antibodies. Then the plasma cells die off quite quickly. There's still memory B cells there, but the plasma cells die off quite quickly. And this doesn't seem to be happening. So again, this is encouraging for longevity of immunity. Sustained immunoglobulin type G, they're the longer-lived immunoglobulins, and the memory B cell response. So the memory B cells are the cells that know how to make these antibodies. So these memory B cells know how to make the antibodies. If stimulated by an arrival of another antigen, these differentiate into plasma cells. And these plasma cells, of course, produce the antibodies. So that is all very encouraging. So the antibodies themselves are lasting longer, and the memory B cell response is lasting longer. And of course, they had sophisticated testing facilities so they could test for the presence of the cells as well as the antibodies. And this bodes well for rapid antibody response upon viral re-exposure. So if you've got these memory B cells that are there, then as soon as the antigen comes along, because you've got maybe, I don't know, maybe 5 or 10,000 of these specific memory B cells, then they can double up really quite quickly. So an hour later you'll have 20,000, an hour later you'll have 40,000, an hour later you'll have 80,000, an hour later you'll have 160,000. So you can get an immune response really quickly. And in most cases, this is enough so that the person remains asymptomatic. The immune response can kick in quicker than the virus can replicate. So that sounds good. Now, virus-specific CD4. Now, CD4 and CD8 are two types of lymphocyte that were generated and maintained. Estimated half-life of 200 days. So that's good. Now the CD4s are the T helper cells, and the CD8s are the T cytotoxic cells. So what you have you have like lymphocytes. These are the white blood cells, the lymphocytes. And there's two sorts of these. There's the big and there's the small. The big ones are the NK cells, the natural killer cells that will kill virally infected cells. The small ones are divided into B and T. And the T are subdivided into helpers, T helper cells, which are the CD4. So T helper cells are the CD4. And what the T helper cells do is they help the B cells to produce the antibodies. They stimulate the B cells to produce the antibodies. And then there's also the T cytotoxic cells. And what the T cytotoxic cells do is, if there's a virally infected cell here, imagine that's a virally infected cell, then these T cytotoxic cells come right next to this virally infected cell like this. They bomb it with poisonous chemicals and kill the entire cell with the virus inside, killing all the viruses inside, thereby limiting the replication of the virus. So the long-lived helper cells stimulate the B cells. So they find out there's memory B cells that are long-lived to produce the antibodies. There's memory helper cells, T helper cells that are long-lived to stimulate the B cells to produce the antibodies. And there's also long-lived memory T cytotoxic cells that remember how to kill the virally infected cells. So all really pretty good news. There's another type of T cell called suppressor cells as well, that actually inhibit the inflammatory and the immune response when it's time to stop. So paper didn't mention T suppressor cells actually. Interesting to know if they'd be there or not. So basically what you're seeing is you've got a very broad spectrum of immune response, all of these cells and the antibodies. So that's good. So CD4 helper cell response targeted several SARS coronavirus to proteins. So that's good. It recognises different proteins on the virus. The killer cells, cytotoxic cells, respond preferentially targeted for nucleoproteins. Now this is interesting. They seem to live longer for the nucleoproteins. So what this means is that if you imagine that's one of the SARS coronavirus 2 viruses with the spikes on it. Now, what a lot of these vaccines and things are attacking at the moment, they are making antibodies to the spike protein, to this part of the virus here, which makes sense because that's the part that actually infects the cells. But of course, if the virus is infecting one of your body cells here, then you've got whole viral particles inside the cell with their spike proteins. And this nuclear bit in the middle here. So you've got the whole thing. Now what happens is when the cell's virally infected, some of these viruses will break down and viral proteins will be exported to the surface of the cell like that. So instead of having only your own proteins on the surface of the cell, you'll have viral proteins. For example, this could be a cell in the respiratory tract. And it's the presence of these viral proteins that attract the memory, the T cells, the T killer cells, the T cytotoxic cells, the CD8 cells, to kill the virally infected cell. So these are responding better to this, the proteins in the core of the virus, rather than the proteins in the spike of the virus. So that means that the vaccines could probably last for longer and have a longer effect if people make vaccines not to the spike protein, but if they make vaccines to the core proteins. So I strongly suspect that's what the next generation of vaccines are going to be doing, making vaccines to the core proteins rather than to the spike proteins. Because probably the main factor actually that's preventing reinfection is these T cytotoxic cells that are killing the whole virally infected cell, therefore killing all the viruses and protecting us. So interesting. It's just a bit of a spin-off from that study, really. So the cytotoxic cell response preferentially targeted the nucleoproteins. This is with natural immunity, of course. This is natural immunity. So the vaccine makers may choose to duplicate that. Importance of including the nucleoprotein as a potential vaccine antigen. That's actually from the authors of the paper. And they're following these patients up for the next 3 years. Then we'll know if it lasts for 3 years or not. Because it's an ongoing thing. We simply don't have that full amount of data. So I thought that was encouraging. So yesterday we looked at information that says that the vaccine response is lasting for 8 months so far. The natural immune response is lasting for 8 months so far, despite a very small minority of people who've had the vaccine and had the infection getting reinfected. We believe it is a very, very small minority. So this bodes well for the longevity of the immune response. And if people are immune, you're going to get this herd immunity effect. The virus won't be able to go from person A to person C who's not infected because immune person B will be in the way. And that, to me, is encouraging that we might be able to get rid of this virus in a few seasons, which remains my hope. Okay, I think that'll do us for today. Thank you for watching, as always.